I'm Dr. K, and this is Psych U for you. Hey, folks, hope you're all well. I'm going to see how this video thing goes. So bear with me. Might not be the best quality, but I'm going to do my best here. So let me switch it over, share my screen with you real quick. So hopefully you can see that okie dokie. Obviously, we're going to be talking about eating disorders. So this is chapter 9. All right, so eating disorders. So in general, obviously eating disorders, I think most folks are somewhat familiar with eating disorders. In particular, you're probably familiar with the three that we're going to talk about and really focus on here. So the three main eating disorders that the DSM-5 focuses on is anorexia nervosa, bulimia, and then binge eating disorder. So those are the three. When you think about eating disorders in general, one of the things that comes up is really this issue around eating in general, and that the individual not only has a lot of thoughts, problems with eating, but a lot of it is related to body image and what they think they need to be looking like. I think this is a major issue in our society, that we have this society that really focuses on kind of this thin ideal, as the book says. And you can imagine that that creates a lot of problems. If you look around in all the commercials, they're presenting thin images. If you hear all of these kind of the big one now is, and has been for a long time, is all these dieting commercials, right? You want to join this program or this Weight Watchers program or whatever it is, all focused on body image and ultimately thinness. That thinness, in particular for women, if we look at the different images on the media, a lot of those images are focused on women and thinness. If you look at commercials, maybe for your favorite TV show or something like that, probably not showing women that we would find in kind of our normal setting. However, with men, it's a little bit different, that you see a big difference in some of the models that are being presented. So if you think about some of the TV shows, a lot of the TV shows, for example, like King of Queens, that used to be one that I used to watch. And here you've got Doug, who's kind of pretty big. And then you've got his tiny little 10-pound, 120-pound wife. And that's showing you that disparity there in our societal norms around eating. And so you can imagine that because of this, the prevalence of eating disorders in females versus males is very different. That females represent about 90% of those who qualify for eating disorders. So it's fairly disproportionate there. I think that we are shifting the way that we understand that, though. We recognize that eating disorders can also be seen with men who look like they're fit, yet their mindset is one that they're not eating as much healthy food. So maybe they're really focused on getting big and ripped, I guess is a word that a lot of times is connected to men. And you can imagine that being muscular and ripped really does create a problem, because when is enough? And you find a lot of folks, especially who get into that, men who get into that routine, it's kind of like, I'm not, I'm not big enough. So they focus on ways to get more muscle mass, or I'm not ripped enough. And so they find ways to cut out, most all fats. If people are competitive, a lot of times they won't even drink water for a couple of days leading up to the events to make sure that they're just stripped of all water in their skin and everything, so that they look as ripped and as big as possible. So starting to shift a little bit, and we're starting to see more and more men getting diagnosed with eating disorders as well. But at the moment, it's still fairly disproportionate, women versus men, women obviously having more connection to eating disorders. So what does the Anorexia Nervosa checklist look like? So here is our DSM-5 checklist. So the American Psychiatric Association's DSM-5 2013 You see that there's, of course, restriction of energy intake relative to requirements, leading to significantly low body weight in the context of age, sex, developmental trajectory, and physical health. So we want to kind of rule some of those things out. Age, we know that as we age, our body tends to gain a little bit more weight. Sex, we know that men versus women, that females hold a little bit more body fat, and that's just kind of natural. Developmental trajectory, we know again through the lifespan that this is going to look different based upon age. We have a sense of kind of where the normal range happens to be. And then physical health, making sure that that our physical health isn't what is maybe making us really look like we've lost a lot of weight, that we might have some other physiological or medical condition. Another thing that's connected to it is intense fear of gaining weight or becoming fat, even though they're underweight. So many times, especially with anorexia nervosa, individuals are underweight and many times severely underweight, yet in their own minds, they're thinking to themselves that they look fat. That's some of that body dysmorphia. Body dysmorphia is when you have this image of yourself that does not represent what everybody else sees. So you might think that you're absolutely fat, but if you were looking in yourself at yourself in a mirror, you would see those little things. But somebody from the outside would look at you and think, "Oh my gosh, this person looks like a skeleton." And many times you see that. If you've ever gone to any pro anorexia websites, which there are a lot out there, where they're encouraging and telling other individuals who have things like anorexia, how to do anorexia better. So they're giving suggestions, they're supporting individuals in that community to lose more weight, to keep getting thin. But you see these images of, we'll just say women on there because it's mostly women again, and they look like skin and bones. Yet, because they can pinch some skin on themselves, they're suggesting or they're seeing that they're super duper fat. So um, they don't want to gain any weight. Um, and that disturbance in the way in which one's body weight or shape is experienced, undue influence of body weight or shape on self-evaluation, or denial of the seriousness of the current low body weight. That's another thing, is that a lot of times these individuals don't recognize how bad of shape they're in. Again, anorexia is one of the most deadliest mental health disorders that we have, and it's because so many times the people are losing so much weight that they don't even know that their internal organs are about to shut down because they've lost so much body weight. And so obviously that's a very, very dangerous situation. So if we look at the different subtypes, one is restricting type, and then the other is binge eating, purging type. So we can have anorexia nervosa, and as a subtype, we might have it restricting, could be binge eating and purging, and it could be both. So restricting type eventually cuts out most of all food. So these individuals, very limited diet. They're eating things like one piece of toast at the most a day, or maybe some crackers or something very, very bland, something with very, very low caloric value. And you can imagine that that doesn't lead to very good health. Binge eating and purging. So some individuals will still, a binge eat for somebody who is severely anorectic. That's going to look a lot different. Where somebody who might be on bulimia nervosa would be taking in, 3 to 4,000 calories per sitting. A binge for somebody who is anorexic may look something like 500, 1,000 calories, which doesn't seem like a lot. It really isn't. However, to that individual, it would seem like a lot. And then the compensatory behavior is to then purge, to vomit, to use laxatives, something like that, or diuretics to get that weight back down. So it may or may not include binging. Many times it doesn't for anorexia, but there's still the purging process that happens so that they can continue to lose weight. So how does this disorder unfold? A lot of times the individuals start off by having a low opinion of the way that their body looks, that they're already looking at themselves and thinking to themselves, gosh, I don't really like how I look. I look too, a common thing is I look too fat. Um, I need to lose some weight. And so a lot of times those individuals will go on a diet. And many times it's folks who are what we would consider to be normal weight, or maybe even just slightly overweight, but they try to diet in order to get that perfect look or perfect weight, whatever they think that that might be. So by doing that, obviously they then push themselves into a cycle, this pattern or cycle around weight. And the focus doesn't necessarily remain around how they're feeling. It's really how they're looking. And that oftentimes creates some issues for them. So can be brought on by some difficult life event. A lot of times that switch from just kind of this dieting yo-yo, they call it yo-yo dieting because they go on one diet, maybe it works for a little bit, then they don't maintain, those eating habits, and then they add some more weight on, and then they go on another diet to lose the weight again, and it just kind of goes back and forth. um, a lot of times what happens is to break that pattern and actually get into more of an eating disorder pattern. Something significant will happen in their life to all of a sudden where maybe they don't eat. Maybe it's a situation of grief, and then they don't eat for a while, and they recognize, oh my gosh, I lost all this weight by not eating because of my grief of a breakup, or maybe they lost a family member, something like that. And so all of a sudden they think to themselves, wow, I can lose a lot of weight by just not eating. And then you see that pattern kick in. So that's just one example of many, many different possibilities there. So most, given the long run, most will eventually recover from this. However, 6% or more do not. And we know that this is a very deadly disease. And a lot of times this 6% that doesn't recover, they either do it well, so they're managing it to the point where they're not getting super duper sick, that they've still got an eating disorder. um, a lot of times it's around their issues are more around control, that they recognize and realize that, gosh, I can at least control something here, and it happens to be my eating process. So maybe it's because they want to gain some control in their life. um, but it's also connected to their body image and self-esteem. And so those individuals who don't recover, many times those folks end up either getting extremely sick and dying, or they are managing it, but they're not well, that they're still so preoccupied with food that it really kind of runs their life. Um, Person normally wants to be thin, fearing weight gain. Again, this is anorexia nervosa. And so these folks will be extremely thin. And if they add any weights, they're constantly weighing themselves, constantly looking in the mirrors, constantly thinking about food and what they're going to do, and kind of thinking and planning. That they have a lot of dreams about food, because that's what our body does. As soon as we get into this starvation mode, our natural biology kicks in and says, guess what? We got to get you some food. And so we got to do it somehow. What do? Well, you think about it a lot, you ruminate a lot, you plan when your next meal is going to be, all of those things. Because your day turns into thinking about and managing your expectations about food, your desires for food, pushing yourself in the opposite direction. But it is, again, part of that is connected to control. And so individuals feel like they have a little bit of control when they're doing that. So oftentimes they distort the world that they see. So the world around them looks different. Like everybody else looks perfect. Look at that perfect body that woman has. How come I don't look like that? So there's a constant comparison. They're looking at themselves in the mirror very frequently, and then really noticing any little thing that they might see as kind of a physical blemish to themselves. So that distortion includes their body size, portion sizes. Somebody might say, oh my gosh, I ate so much. Well, what did you eat? I ate a whole piece of toast. Wow. Okay. Most folks, that's not a very big portion size, but maybe for somebody who's only taking in, 100, 200 calories a day, that could be seem pretty significant for one meal. Thoughts about themselves and what being thin or being fat really means. A lot of this goes back to self-esteem, and being thin or being fat means something to that individual. It means maybe I'm not who I want to be. Maybe it means that I'm ugly, and a lot of times that goes to a deeper connection. It means that because I look like this, I'm not lovable. that nobody would want somebody who looks like me. And you can imagine that that leads to some really, really deep, dark feelings. And so a lot of times individuals with anorexia nervosa also have a other mental health disorder connected to it. And we'll talk about that in a second. So yeah, I just mentioned this, right? With this eating disorder, there's usually other mental health issues. A lot of times, depression, anxiety, OCD, or obsessive compulsive disorder. That those are very common. Low self-esteem is almost always connected with this. Many times, sleep issues pop up, and when you're not getting enough food, you're either sleeping excessively because you don't have the energy to make it through the day, or a lot of times it seems opposite, where people's minds are always racing around how do I get food, and your body's not necessarily letting you sleep as much because it's wanting you to go seek food. So sleep issues are fairly common as well, and this is just a small list, a lot of different things, many times co-occurring with substance abuse. So a lot of times individuals with are abusing some other substance. So this could be other things like different diuretics that are going to help them kind of extract their body of all water. Could be, using other kinds of medication to help them kind of stay. A lot of times, amphetamines are something that folks use because it speeds up your process. So that is something that happens there. With this ED or eating disorder, it can be a number of medical problems. So you have your eating disorder, which is more of a mental health problem, but because of this mental health problem, there's all kinds of physiological things that happen. So amenorrhea might be one. So this is the loss of your period. Once you get to that stage, your body is telling you that, guess what? I am not getting the appropriate nutrients, and people lose their period. And sometimes people are happy about that they've lost their period, and it's showing them that, gosh, look at this. I have changed the way that I have so much control that my body is shutting features down. Low body temperature is very normal, especially with individuals who have lost a lot of their body weight. Low blood pressure, lanugo. So if you remember back to the earlier chapters when we were talking about the newborn, they have that fine hair that kind of covers their whole body that they lose. Lanugo actually shows up again in many women who have. I haven't heard it and seen it as much with men. I'm sure it would happen with men as well, but I've seen it more with women. But that loss of body weight encourages hair growth again, the lanugo, that fine hair. Bone density issues. And so if somebody has an eating disorder, that they need to really get their bones scanned frequently, because there's a lot of bone loss, which leads to fragile bones. And this not only increases your chances of osteoporosis, especially for females, as you'll see in the later chapters here. Calcium loss and bone density is already going to be an issue. And so folks with eating disorders, it becomes even more so. And it can be very debilitating, that individuals who have endured eating disorders over a long period of time, many times they're just physically in pain constantly. So a 50-year-old might look like a 70-year-old because their bones are so thin, because their joints are always aching. They're oftentimes in pain. So there's long-term issues, slow heart rate, electrolyte imbalances because of not getting the appropriate nutrients, and then hair loss. A lot of times these folks are losing big clumps of hair. You can see the quality of individuals' hair gets very, very thin, not a lot of volume to it, but that's because, again, you're not getting the appropriate nutrients to keep those physiological systems going in a balanced way. So I am going to leave this one to you, but this is so if you go out to YouTube and go to YouTube and look up Laura Hill TEDx, and you'll see her do a presentation, a TEDx presentation. It's about, I think it's like 17 minutes, where she talks about what it's like to have an eating disorder, and the thought process that goes along with this, how these women are feeling, how loud it is inside their minds with all of these competing voices telling them that they should do something, or giving them a sense of shame and guilt. All of those things are feelings and thoughts that they'll go through. And Dr. Hill does a really nice job of explaining all that, and then the process of an eating disorder, and what's been helpful for her, how she has worked through with some of her own patients. So check that out. We are not going to check it out now. Let's keep going here. So DSM-5 criteria. So that's the nuts and bolts of anorexia nervosa. The book goes into a lot more detail. I would encourage you to definitely, you want to still read through the book. It gives you a little bit more information, and that's going to help you do a little bit better on the quiz. But let's talk about bulimia. So another eating disorder that we'll focus on is bulimia nervosa, which is another, really anorexia and bulimia are kind of the top two that really stand out as being the most prevalent. But I think that a lot of folks deal with eating disorders, just not to the point where we see it really disrupting their world like anorexia and bulimia can. So bulimia nervosa, DSM-5 criteria, engages in binge eating on a recurrent basis via episodes characterized by eating more food in one sitting than most other people would. The sufferer also experiences a lack of control over how much food they eat, or feels unable to stop eating. Also recurrently takes inappropriate steps to prevent weight gain, such as vomiting, fasting, excessive exercising, misusing laxatives or diuretics. Experiences episodes of binge eating and compensatory purging behaviors at least once a week for 3 months or more, and then preoccupied with body shape and weight in self-evaluation. So this is the DSM-5 criteria. I think, the big thing is that these individuals are eating huge quantities of food, and so they'll sit there and really consume way more than most of us would eat, oftentimes in a full day. And so you can guess that that's creates a lot of tension. There's a lot of tension before a binge happens. It provides a temporary relief. So here in this binging situation, individuals oftentimes have this temporary sense of, oh gosh, I feel satisfied, but it goes away really quick, because then all of a sudden shame and guilt really kick in, and all of a sudden that temporary relief is lost, and then the cycle kind of starts again. See here, a lot of times this could be also seen in exercise. Going back to anorexia for a second, a lot of times people will eat normally, in a healthy normal. So they might be taking in like 1,500 to 2,000 calories, and you would say, yeah, that seems like this person is eating normally. However, what they do instead is they exercise excessively. So they might go into the gym and they took in 2,000 calories during the day, but they burned off 4,000 calories in the gym because they sat there and they ran for 6 hours straight on the treadmill. Okay. Some people would say, well, that person's healthy, but you see that this leads to some very, very negative things for that individual, because it's around the thinness. They continue to lose weight. Their body is not getting the appropriate amount of calories that's needed. And these folks oftentimes can survive a lot longer until their body weight drops too much. And then all of a sudden their body weight drops too much, their body fat drops too much. And that's when even, these folks who are super duper in shape individuals, their organs are still going to shut down once they've lost too much fat, because then your body starts to kind of eat itself. So the same can work with bulimia nervosa, that they can use excessive exercise as one way out, and it looks healthy, but really, they're in this negative process that really does hurt them mentally. So how does bulimia nervosa unfold? So usually it begins in adolescence or early adulthood. So if we look at those who kind of fall into the category of bulimia, this is usually the age range that we find folks in. Um, Again, it's fairly similar to anorexia, where a normal weight or slightly overweight person has been on a diet. Again, the majority is female. Once the diet fails, then the individual may resort to binges. So these are moments, these binges are moments of uncontrollable eating of large quantities of food, and very often done in secret, almost always done in secret. And so there's a lot of effort that goes into planning. um, there's a lot of effort that goes into making sure that nobody will discover them. So they're oftentimes not only planning the food, but they're planning on when they're going to do it. They're planning how they're going to do this so that they don't get caught, because there is already a lot of guilt and shame associated with it. But then, to keep that part at least hidden, relieves or alleviates a little bit of the guilt and shame tied to it. So while they're binging, and I was working with a gentleman when I was working at the University of Washington, and he had binge eating disorder, and he would sit there, and one of his favorites was ice cream, and he would say that he would have, back in the day, you get those square containers of a gallon of ice cream, and he said that he would sit there and he would tell himself, I'm just going to have a couple scoops. But he, in the back of his mind, he knew that he was taking over a whole box, a whole gallon of ice cream, and one's in a spoon kind of leaves him open. If he was to dish it into maybe a cup or something like that, okay, that might help him a little bit more. And so he would go into this state, he called it like a blackout state, where he would just eat. And he wouldn't exactly know how long he'd been eating for. All he knew was by the time he kind of came to, so to speak, a whole gallon of ice cream would be gone. Like, he just sat there and just chowed it down. And he talked about going into these things. He really enjoyed ice cream. He also enjoyed nuts, and so he would go to Costco and get a big huge thing of nuts and sit down and eat almost the whole thing in one sitting. And you can imagine that's thousands of calories right there. Um, so these can be up to 30 episodes. These binges can be up to 30 episodes a week. That's quite a bit, but oftentimes it's once or twice a day. And these individuals are taking in that 2 to 4,000 calories. It's a lot of calories. A lot of times focused on soft texture, high calorie foods. That's why I think the ice cream pops up quite a bit. Person experiences guilt, shame, self-hatred, self-blame. All of these things come up afterward. The fear of weight gain often leads to those compensatory behaviors. So when they talk about compensatory behaviors, they're really talking about maybe going out and over exercising, or if they're purging type, they're throwing up. They're binging and then throwing up right afterward. Whatever they're doing, they're trying to do something to maintain their weight. And so, unlike anorexia nervosa, individuals with bulimia nervosa will many times maintain what looks to be a normal weight. So folks a lot of times won't even recognize that somebody is suffering from bulimia nervosa because their weight stays around average. This can last for years, and it can go away and then come back again. So sometimes you've kind of dealt with it, but a life stressor comes up, or maybe, because of that life stressor, the individual has put on extra weight, and they know that, oh gosh, what I did before actually worked. And so they might engage in and kind of go back to their binging, maybe purging, or maybe just using the purging part to kind of lose some weight, or the extra excessive exercise, whatever it happens to be. Um, these are the compensatory behaviors, most common ones: vomiting, laxative use, diuretic use. Those tend to be with bulimia in particular. Anorexia uses the exercise a little bit more so than the bulimia does. Do the behaviors work for them? Yes and no. No, because most of the calories ingested don't actually get purged out. So if somebody is using vomiting as their compensatory behavior, that they've taken those calories, but by the time that they're ready to vomit, they've already absorbed in or taken in, 75% of those calories can't be vomited out. So another 25% is what they're really vomiting out, but the other 75 is still there. Yes, because most people are able to maintain their weight. So the goal is around weight management, weight gain, sometimes control as well, and they're able to control their weight with this process. Yes, because the tension around eating is temporarily relieved. So in those moments where they've got the planning going on, everything is building up to this moment of being able to sit there and have their binging episode. And in that moment, right afterward, yes, they have a sense of relief that the tension is broken. But no, because there's a lot of negative thoughts and experiences that pop up shortly afterwards. So for the small amount of time that they have a sense of a mental health satisfaction, they've been alleviated from their anxiety and stress for a little bit. All of a sudden, it kicks right back in. The guilt, the shame, the self-hatred, all those things start to pop up again. And so the process starts again really, really quickly. And then the planning starts. And then, the hiding of food. A lot of times individuals will hide food in different places so that nobody can keep track of food. So people don't know that somebody is eating, as much food as folks are eating. So that's what I have now for those for bulimia. Um, the big difference between the two is really around ultimate thinness, in that individuals with anorexia nervosa, that they oftentimes are just focused on getting thin, and they fear fat. They fear fat so much that they will do whatever they can to continuously lose fat. Um, Also with the anorexia nervosa, the body dysmorphia, or their understanding of their own body image, is more frequently distorted than it is with individuals who have bulimia nervosa. So that's a difference as well. The other thing with folks with bulimia, the anorexia nervosa, individuals with anorexia nervosa, their weight continuously is dropping, getting lower and lower and lower. Individuals with bulimia nervosa, oftentimes their weight stays steady, fairly steady. So that's a big difference there. And you can imagine that the health concerns can be different for the two as well. Both of them are having issues with getting the right nutrients, but it's a lot more extreme with individuals with anorexia nervosa. Many times, some of the extreme issues that individuals with bulimia are facing have to do with the acid. If they're the purging type using vomiting, many times the acid that's coming up from their stomach is potentially, wearing holes in their esophagus. A lot of times they'll have dental issues. Their teeth will get eventually kind of slowly deteriorate because of the stomach acid that continuously comes up. So esophagus issues, sometimes it can lead to throat cancer and things like that if they've been vomiting for a long, long time. So those are some of the big differences between the two. A lot of times bulimia and anorexia, it gets confusing as to which is which. But that's where I'm going to leave y'all right now. I'm going to keep working on more videos and hopefully get some more videos up later on this week. So hope y'all are well. Take care, and we will see you hopefully soon.